Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guest is Dr. Jessica Berman, who is a family practice physician in Mechanicville. Let's go meet her. Dr. Berman, thank you for joining us today.
Thank you for having me.
Tell me about your background.
Well, I went to Duke University for undergrad, and then I went to medical school at Boston University School of Medicine, and I graduated in 2001. Then for residency, which is a 3-year program after you finish medical school, I went to Albany Med Family Practice Residency Program, and I graduated in 2004. And I've been working in Mechanicville for the past 2 years as a family practice doctor.
And you're board certified in family practice medicine.
Right.
What does board certification mean?
Well, at least in family practice, it means that I took a specialty exam in family practice and passed it. For family practice, you need to take that exam every 7 years, and in the in-between years, you need to do some educational things to make sure that you're up to speed with current practices.
And how does family practice differ from a general internal medicine specialty?
Well, family practice used to be what was called general practitioner. It became a specialty in 1973, and it differs from internal medicine in that we see children as well. So we see all ages, from birth to 110. And some family practice physicians also do obstetrics, so they also deliver babies and take care of pregnant women. That's not so much in this part of the country. In this part of the country, we generally don't do OB, but more in the western part of the United States, they do OB. And we take a more holistic approach, I think, because we're treating the whole family. So if I see a child in the office who has an ear infection, I'm going to ask about smoking because that is a risk factor for ear infections. And if the mother or father says, yes, they smoke, I'll say, well, would you like to come back sometime to talk about how we can help you quit smoking? So that's a great opportunity there.
Or you can suggest that perhaps if they're going to smoke or if they have to smoke, they can do it away from...
Absolutely. I mean, you definitely don't want them smoking inside the house. You definitely want them smoking outside the house. But even that is a risk factor for medical problems in children. It's still on your clothes and that type of thing. So you really want them to quit smoking completely.
So tell me about the history of the Family Health Center.
It's a unique office. It was started by the Scambottis, who are a big family in Mechanicville. Dr. Stephen Scambotti is 86, and he's still practicing 2 days a week. He started the office, I think it was 1955 about, and he and his wife had 15 children. So his oldest son, Dr. Scambotti Jr., joined the practice in about 1975. And his youngest son, Dr. Carl Scambotti, joined just this year. And myself, and there's another doctor, they're also part-time, Dr. Catherine Herzig. So there are a lot of people who are been going to Dr. Scambotti Sr. or Jr. for 20, 30 years as children. So it's very, very interesting place.
So describe your typical day.
Well, I'll generally see about 18 or 20 patients a day. Generally have about 20 minutes to see each patient. That's what's scheduled. During the visit, you'll want to ask what concerns the patient has, but then there's also things that I want to talk about, like helping them quit smoking or their high blood pressure. And then you do an exam and maybe do some blood work, maybe some x-rays, review other records from other doctors, then make a plan about if we're going to start any new medicines, when they're going to see them back again, if we're going to send them for other studies. So all of that can take less than 20 minutes. It can take more than 20 minutes.
But the chart documentation and everything else is also included in that.
Yeah,
20-minute
well,
time
I
period.
do that afterwards. Some doctors do actually write the note while they're in the exam room with the patient, or they dictate while they're in the exam room. But I do it afterwards. So that's, time afterwards. I try to catch up in between patients or during lunch or after the day is done.
And you do dictation.
Yeah, I do. For me, it's
Probably easier.
It's easier. My handwriting is very bad. And the medical record is for me to look at later and also for other people to look at. So I think it's important that other people can read what I'm saying.
I would say so. So let's talk about immunizations. Number one being that it's this time of the year, flu season is beginning. Flu shots.
Yes. This is something I feel pretty strongly about. Flu/pneumonia is the 6th leading cause of death in the United States. It causes about 40,000 deaths each year in the United States, which is really amazing. And the ones who are most susceptible to complications from the flu are young children, the elderly, people with underlying medical problems. So right now it's recommended that it seems like practically everybody should get the flu shot is what I think. And they keep changing the recommendations each year. But right now they're saying children 6 months to 6 years should get it. That's a change from before. They used to say 6 months to 2 years. And everybody over 50. So that's a lot of people right there. Then if you're in between 6 years and 50, if you're a healthcare worker, if you have underlying medical conditions like diabetes, heart disease, emphysema, and if you're pregnant. And if you're living in a household or in close contact with any of these other people. So it's really practically everybody. The flu shot is a killed vaccine. You cannot get the flu from the flu shot.
I've heard that people get sick as a result of it.
You can get a mild cold-like illness. Now, in the past, maybe if people got the flu shot maybe 10 or 15 years ago, there were more preservatives in it, and so people may have had a bad reaction to it, but now...
The preservatives.
Yeah. So, but now the flu shot is really sort of milder in terms of their preservatives, so you really shouldn't have a bad reaction to it. And the flu in yourself might not be so bad, although you might have to take time off from work, take care of your kids, that type of thing. But if a lot of people get the flu shot, it's also going to help prevent there being not so much flu around to spread to people that might be more susceptible to it.
Is that what herd immunity is?
Yes, it is.
You treat the herd.
Right.
Basically.
Herd immunity means that if you vaccinate a lot of a population or herd, that it'll help people who are not vaccinated because there's less disease around.
And what is Tdap?
Tdap is a new vaccine. It has, now children normally get something called DTaP, which is diphtheria, tetanus, and pertussis. That's what they get at 2, 4, 6 months. They get a series of 5 shots of that. Tdap is confusing. Tetanus, diphtheria, pertussis also, but this is for people 11 years and up, not for the infants. And so prior to this new Tdap shot, people were supposed to be getting tetanus boosters every 10 years. So starting at age 11, you're supposed to be getting one every 10 years. That old one didn't have a pertussis in it. This new one does. Pertussis is whooping cough. Whooping cough is not a very debilitating disease in most adults and adolescents. It's called the cough of 100 days, meaning that you cough for 100 days and you might lose some time from work, that type of thing. But it's very debilitating to people who are not vaccinated, meaning infants. So this push is really to vaccinate adolescents and adults so that, again, there's not as much disease around, so that unvaccinated infants won't become sick from pertussis. When I was working at St. Peter's Hospital, there was a 1-month-old infant there who had apneic spells, which means that she stopped breathing. So that's pretty scary. And it took a little while to figure out that it was pertussis that she had, but we did figure that out, and she ended up, actually she had to go to Albany Med, and she was there for a month. So that was quite, debilitating.
Oh boy. And then there's new HPV vaccines. Those are only for women, right?
Right.
Because
HPV is human papillomavirus. It's a sexually transmitted virus, and it's the virus that causes 90% of cervical cancer. And it's basically the reason that we do pap smears for. Pap smears are to screen for precancerous lesions of the cervix. And they're generally caused by human papillomavirus. So this new vaccine, it's only been out 2 or 3 months. It protects against some of those viruses that cause cervical cancer. It's a series of 3 shots, kind of like hepatitis B, where you get it the first shot, and then one in 1 month, and then one in 6 months. And the ideal time to give it is actually before a girl is sexually active. So it's licensed down to 9 years old. But now they're saying, now the CDC is suggesting that it's be given when they get their Tdap shot at age 11 or 12, that you also start the HPV vaccine. Right now they are projecting that it lasts for about 5 years. Hopefully it'll last longer, so you won't need a booster shot. And I think it should be given to boys as well, because if you're going to lower this virus being around, you want to immunize the boys as well, who are the carriers of it, even though they're not going to come down with any disease from it. That's probably in the future, in 2 or 3 years.
So those are immunizations and vaccines. Now we can talk about preventative health care. What do we have to do to try to keep ourselves healthy? There's cancer screening.
Yes, and I was talking a bit about cervical cancer screening in terms of getting pap tests regularly. It's recommended that one starts getting pap tests 3 years after you're sexually active, or at age 21, whichever comes first. And then you generally want to get the pap test yearly until about age 30. If you've had all normal pap tests, then you can actually reduce the screening to every 2 or 3 years. Mammograms are another important screening tool for breast cancer, and that should be done generally in women annually over the age of 40.
Over the age of 40.
Mm-hmm.
Okay. About colon cancer screening?
Colon cancer is another important one. That should be started in everyone over 50. Unless you have risk factors for having colon cancer, then it should be started earlier.
So male or female?
Exactly, yes. The pap tests and mammograms were for just females. Now we're talking about males and females. Colon cancer is a very preventable cancer, I feel. All colon cancer basically starts from precancerous polyps. Polyps are sort of outpouchings in the colon. And on a colonoscopy, these can be, if there are polyps there, these can be removed, and then you've removed the risk of cancer. And colon cancer is very slow growing, so a colonoscopy only needs to be done every 10 years. And if a colon cancer is caught at this early stage, when it's just a polyp, it's very treatable. If it's caught at a later stage, it's, the 5-year survival rate is much lower. So, colonoscopies are important.
Okay, and prostate cancer screening?
Well, prostate cancer is a little bit controversial. It's quite common in elderly males to have prostate cancer, but it's generally slow growing. So generally, an elderly male is possibly going to die from something else other than the prostate cancer. And the treatment for prostate cancer can cause some problems with ejaculation and urinary problems. So it's kind of controversial if we should even be screening for prostate cancer. because the cure might be worse than just living with the disease. But if you do opt to screen for prostate cancer, that would be a rectal exam where the doctor can examine the prostate, and also doing a blood test for PSA, and that should be done yearly.
Okay, and then blood pressure and cholesterol.
Right.
We should get our blood pressure checked, obviously.
Yeah. The number one cause of death in the United States is heart disease. So, heart disease risk factors for that are cholesterol and high blood pressure. So, everybody over 18 should have their blood pressure checked yearly. Cholesterol should be checked in men earlier than women because women are protected if they're still ovulating by their estrogen. So men should be checked over age 35, women should be checked over age 45. Unless there are risk factors for having heart disease like smoking, obesity, diabetes, family history of heart disease. Yeah.
And what is bad cholesterol? What's good and what's bad?
Well, a lot of people just look at the total cholesterol level, which is important, but doctors look more at the bad cholesterol and the good cholesterol levels. Bad cholesterol is your LDL, and your good cholesterol is your HDL. Your HDL helps clear your body of cholesterol, so you want that number to be high. Above 40 is good. LDL is your bad cholesterol, causes heart plaques, that type of thing. And where we want that level to be varies depending on your risk factors for heart disease. So it's sort of complicated, but somebody who doesn't have any risk factors for heart disease, meaning they don't have high blood pressure, they don't smoke, they don't have a family history of heart disease, they don't have diabetes, we can tolerate their bad cholesterol being 130 to 160. But if somebody has diabetes or if they have a lot of risk factors, we want their bad cholesterol to be less than 100. And actually, they keep lowering that number every year. Now they're saying less than 70. So people who you want their cholesterol to be less than 70, it's really hard to do that by diet and exercise. Generally, you need to be on a medicine to get it that low.
And once you're on the medicine,
that's
you
right.
cannot stop.
Yeah, I also have patients who think that I put them on cholesterol medicine and they get their blood work checked when they're on their medicine and the cholesterol is good. So then they think that they can stop it because they've been cured. But that's not true. You need to keep taking the medicine in order for it to keep affecting your cholesterol. So it's generally something you need to be on for life.
I'm sure the pharmaceutical companies are happy about that.
Yeah.
Okay, so family planning, preconception counseling.
Yes.
What is required for that?
Well, this is something where you visit a doctor before you're actually pregnant to help have a healthy pregnancy. It's important to quit smoking. It's important to be at a healthy weight and be eating right and exercising. But another important thing is to be taking folic acid every day. And this is something that's not really well known. I think maybe because there's not a drug company pushing it, because it's just an over-the-counter vitamin. But folic acid helps prevent neural tube defects, which is formation of the nervous system in the fetus. Neural tube defects are spina bifida and anencephaly. Spina bifida is when the backbone doesn't close completely, and anencephaly is when the brain doesn't form. So these two things are very detrimental and can cause a lot of disability. Taking 400 milligrams of folic acid a day can prevent 70% of those neural tube defects. And there were about 3,000 babies affected by neural tube defects in, I think it was 2001. So
is that the same thing as prenatal vitamins?
Prenatal vitamins, yes, have enough folic acid in them. So if you're trying to get pregnant, you should definitely be taking a prenatal vitamin or folic acid. You do want to start taking it 3 months before you want to get pregnant, because the nervous system forms in the first few weeks of pregnancy. And this is usually before women even know that they're pregnant, because you usually don't know you're pregnant until you miss a period, so that's actually 2 to 4 weeks into the pregnancy. And that's exactly when the nervous system's forming. So you want to be taking it before you even get pregnant.
So let's talk about the dangers of smoking.
Okay.
According to the American Heart Association, 46 million smokers in the United States. 1 in 4 males, 1 in 5 females.
Yes. And I can add to
Dangerous
those.
habit.
I can add to those statistics. It's the #1 preventative cause of death in the United States. And about 440,000 deaths each year in the United States are attributed to smoking.
There's now 10% more nicotine in cigarettes, which makes it even more difficult to quit.
Yes, I've heard it's supposed to be more addictive than heroin. So that's what I say to patients. I understand that it's a very difficult thing to do. I'm not saying it's easy, but it's really important. It leads to all sorts of risks of all sorts of cancers: lung, cervical, mouth, esophagus, kidney. And you double your risk for having a heart attack or a stroke, 10 times the risk of dying from emphysema. And you also have risks in pregnancy of infertility, stillbirths, and you have 4 times the risk of sudden infant death syndrome. And in women, it also leads to osteoporosis.
What about secondhand smoke? What are the dangers of that?
That's also a problem. It contributes to 20,000 deaths a year from cardiac disease, secondhand smoke, and 3,000 deaths from lung cancer a year, just secondhand smoke.
So what's the easiest way to quit?
Well, there are multiple ways to quit, and there's a couple of medicines out there that can help also. There is an antidepressant called Wellbutrin. It's also called Zyban. That's been out for a while. That's just a side effect of the antidepressant was found to help people quit smoking. I've heard people say, well, it helps with the mood swings when you quit smoking, and I've heard people say it also makes the cigarettes taste bad, so you really don't feel like smoking as much. So that does help quite a few people. You need to use a nicotine patch in addition to the Wellbutrin, and then those two things really work very well together. And you continue on the Wellbutrin for about 3 to 6 months after you quit smoking, so you don't go back to it. There's a new medicine out now called Chantix, which has been out for about 2 or 3 months. That is a different kind of medicine. It works on the nicotine receptors in your brain. And there's been a lot of good luck with that too. You don't need to use a nicotine patch with the Chantix. So with people who do want to quit smoking, I have them try the Wellbutrin first with the nicotine patch, and then maybe if that doesn't work for some reason or if they have some side effects from it, I try the Chantix. I've heard a little bit back from people about the Chantix. Some people it works quite well. Some people it doesn't. It's not a magic pill. You know, it's not going to help everyone. Another big thing is your own mindset, of course.
And it can be dangerous to smoke while you're using the patch.
Well, yes, that's true, and not everybody knows that, so I do try to emphasize that. First of all, it's going to make you feel pretty sick because you're getting a big rush of nicotine, so you're going to have probably a big headache and feel nauseous. Second of all, there's a risk of having a heart attack from that because of all the nicotine. So when you're ready to use a patch, you definitely want to throw out all your cigarettes.
And hopefully not buy more.
Right, right. Well, that's another thing I bring up was how expensive it is and how much money you're wasting on cigarettes. I mean, $5 for a pack. You know, if you're smoking 2 packs a day, $10 a day. What is that, 36,000? Did I do that right? I think it's $36,000 a year. $10 a day.
Wow.
Right.
That's expensive.
Right.
All right, let's talk about viral versus bacterial infections. What's the difference between them?
Well, sometimes it can be hard to tell. The 2 major bugs or germs out there are viruses and bacteria. Viral infections are generally your common cold, flu. Sinusitis is usually a viral infection. Bronchitis is usually a viral infection. bacterial infections are generally last longer. You have a higher fever. Things like urinary tract infections, pneumonia, some ear infections are bacterial. So that's some of the differences. Now, antibiotics only work against bacterial infections. And the biotic means bacterial, so antibiotic, only bacterial infections. They do not help with viral infections. This is a big problem. A lot of people expect to get an antibiotic when they go to the doctor for what is probably a viral infection. I mean, you need to go to the doctor and have the doctor take your history and examine you and decide if it seems like a viral or a bacterial infection. I think, like I was saying, I think a lot of patients expect an antibiotic, maybe because they feel like that's validating their illness, that they actually, well, they're self-diagnosing.
And they're asking for an antibiotic.
Right.
When they don't know if they need one or not.
Right, right. A virus can last for a while. It can last for a couple of weeks, so you feel like a patient may feel like they're validating that they actually are sick when they do get an antibiotic. And I'm not saying that viruses don't make you feel really sick and that you don't need to rest and take care of yourself during that time. I mean, the flu really makes you feel like you should be in the hospital. I mean, you really feel bad. But it's a virus, and an antibiotic isn't going to help. So the Center for Disease Control estimated that 50% of antibiotics that are written by outpatient physicians are unnecessary.
Unnecessary.
So we are, giving into this somewhat. And sometimes it's hard to tell if it's a virus or a bacteria, so you might say, well, let's try it and see if it helps. But the problem is, some of the problems are antibiotic resistance is going up, which means that there's bacteria out there that won't be cured by our general antibiotics and might need some bigger guns, or there might be some bacteria that's not cured by any bacteria because they're resistant to a bunch of different antibiotics. And other problems with prescribing antibiotics are you can have side effects from the antibiotics, and they can be expensive, and they're not really going to help.
Oh boy. Okay, obesity and diabetes. There is an obesity epidemic in the United States. The CDC estimates that 67% of adults and 26% of children are overweight or obese. Can you describe the health risks associated with that?
Yes. Now, when we talk about being overweight or obese, there's specific numbers that we look at. We look at your body mass index, which looks at your height and your weight. And a healthy body mass index, or BMI, is less than 25. If it's over than 25, we say that you're overweight. And if it's over 30, we say that you're obese. And when we're looking at these body mass index, we're not talking about appearance. I mean, the concern here is not your appearance. The concern is your health. So being obese is after smoking, it's the second most preventable cause of death in the United States. It leads to an estimated 300,000 deaths a year. And it leads to an increase in risk for diabetes, hypertension, high blood pressure, stroke, heart attack, and gallbladder disease are some of the more common things.
I read that the average TV viewing time per day in the United States is 8.2 hours. I'm sure that must contribute.
It's unbelievable.
To the epidemic.
Absolutely. For children, you want to limit TV to 2 hours. Well, they say screen time, which means TV or computer time, to 2 hours a day. Kids should be getting at least an hour of moderate physical activity a day. Schools should be having gym every day. That's been cut back on. Adults should be getting, they say 30 minutes most days, which is hard to do. You need to make it a priority. And you need to eat better. I mean, to lose weight, you need to burn off more than you take in, basically. So eating not fast food, no sodas, eating 4 to 5 servings of vegetables a day. These are all important things.
So basically what you try to do is you go to the supermarket and you follow around
So
the
that's-
exterior of the aisles and try not to go to the interior.
That's interesting,
section.
yeah, because all
So
the
that
processed
you're in
food.
the fruits and vegetables and the dairies, and
Right.
that's the healthy stuff.
Right, that's right.
Okay, we are pretty much out of time here.
Really?
We are. Thank you so much for coming.
Well, thank you for having me.
Jessica Berman, MD, from the Mechanicsville Family Health Center. Thanks for watching. Please join us again on Focus on
my
Health.
God.
Welcome to Channel 17, the Town of Colonie Government Channel.